So what would actually happen if you stopped your antidepressant cold turkey? Let's dive in. So when you've been on antidepressants for years, your brain adapts to the constant boost in serotonin from the drug. Over time, it reduces its own serotonin production because it expects the medication to be doing that job. And if you suddenly remove the drug, serotonin levels drop sharply, and this sudden drop throws your brain chemistry completely off balance. And that's what's causing antidepressant withdrawal. So in the early days, days 1 to 5, this is really the easy phase. Many people actually feel better during this time. They say the emotional blunting lifts and they feel more like themselves. They might even think, wow, this is easy. Why didn't I do this sooner? But this is really the calm before the storm, because what most people don't realize is that it can take about 5 days for most antidepressants to fully leave the body. So you're not even in withdrawal yet. Now, days 5 to 30 are the worst. This is when the brain is fully exposed to the antidepressant withdrawal. And most people will experience severe symptoms like brain zaps or dizziness, severe insomnia, mood swings and tearfulness, and sometimes even dark, intrusive thoughts. Now, these symptoms aren't just mild. They can be highly distressing and disabling. Most people cannot tolerate this phase, and sensibly, they will restart the medication. I briefly want to mention one of the biggest tragedies in psychiatry right now, and that is that many doctors will misinterpret the withdrawal symptoms as the patient's underlying condition returning. And they will tell them, hey, you just need to stay on this drug forever. But none of that makes sense because brain zaps or dizziness are not symptoms of depression or anxiety. When the truth is, patients could have come off these medications if they just tapered in a more gradual way. Days 30 to 90 are marked by gradual improvement. For those who make it through the first month, the symptoms start to lessen. The brain begins to readapt to life without the drug, and the withdrawal symptoms begin to gradually fade in intensity. Some people may be pleasantly surprised to notice that old side effects aren't there anymore, like sexual dysfunction or emotional blunting. And for many, thankfully, this is the end of the experience. The brain will gradually continue to recover, and the withdrawal symptoms generally go away completely in 3 months. But sadly, that's not the story for everyone, because there is a small group of patients who will go on to develop protracted withdrawal, which is a severe condition which is like a brain injury induced by that electrical storm of withdrawal. Now, patients who develop protracted withdrawal will often experience severe, never-ending anxiety. They'll feel like they can never relax. They'll have cognitive impairment, light and sound sensitivity, abnormal feelings in their hands and feet and face, sometimes nerve pain. They can also have digestive issues. And these symptoms don't just last months. Sometimes they can last even years. And the worst part about it is reintroducing the drug does not fix this. This is because the symptoms the person is experiencing isn't from like drug withdrawal anymore. It's actually from neurological damage induced by the electrical storm of the withdrawal. The only thing that fixes this is time. And for many people, this can take years to fully go away. Right now, we don't know how common this is when people go through cold turkey withdrawal, but there are hundreds of thousands of patients online complaining about this experience on Facebook groups or forums like Surviving Antidepressants. And this does seem to be more common for patients who cold turkey off the meds after being on high doses and using them for several years. So what can you do to avoid these nasty withdrawal symptoms and minimize the risk of protracted withdrawal? Step 1, I would recommend that you reduce your dose by 5 to 10% per month. This can be easily done if you ask your doctor to prescribe your medication in a liquid formulation, where you can use a syringe to precisely lower the amount of medication you take each month. Step 2, listen to your body. If withdrawal hits hard, go back to the last dose where you didn't have symptoms. And the next time you do a reduction, do a smaller one. And finally, step 3, take your time. A safe taper can sometimes take a year or even longer for some people. Slow and steady is far safer than rushing. I hope this video was helpful. And if you want to understand the risks of long-term antidepressant use, you're not going to want to miss one of our viral videos, 5 reasons to avoid taking antidepressants long-term.